So, Dr. LeRoith, you are the head of the division or the department of diabetes and endocrinology at Mount Sinai in New York, which is a huge, incredible hospital. You were mentioning before offline that within your department there is a very well organized weight management program and obesity treatment program. So you've mentioned a few times the connection between type 2 diabetes and obesity, and that's part of what you are doing, is trying to enhance that obesity control. Can you speak briefly to our audience about really what's the cutting edge in managing obesity? We spoke a little bit about diet and exercise. Are there other particular treatments? People talk about obesity surgery.
Mm-hmm. So first of all, there are now 5 or 6 medications that are purely prescribed for obese individuals. Most of them have an effect on appetite, and they have some degree of success. In many individuals who are so overweight that this medication or exercise or lifestyle change has not been successful, and you can usually decide if it's going to be successful or not, we're now using much more in the way of bariatric surgery, either for obese individuals. So if you're grossly obese, you may undertake bariatric surgery, and that may even be reimbursed by the medical aid. Mm-hmm. On the other hand, if you have diabetes and obesity, that may be an indication for you undergoing bariatric surgery. So in most institutions that have a very good team approach, we'll have the endocrinologist and all the allied physicians and nurses, etc. But we'll also have a team of bariatric surgeons. And they can then perform the surgery, and you can actually get what's called a remission. So you can have diabetes, undergo the surgery, lose the weight, and other metabolic effects happen, and your diabetes apparently doesn't need treatment. Your blood sugars come almost normal. Problem again is, after 5 years, about 50% of those patients, the diabetes will reappear. Mm-hmm. But again, it will be much less severe than they had before the surgery. So it's a team approach, both medical and surgical.
And so you mentioned that some people who undergo bariatric or weight reduction surgery will completely remit in their diabetes will go away. And a good proportion of them, they do develop diabetes again. Do they do that through the path of becoming obese again, or it happens without the obesity?
So both. You can have bariatric surgery, and not all patients will maintain the lower weight. Mm-hmm. You can basically overcome this bypass, as it's called, of the food intake. On the other hand, there's the aging aspect, as I mentioned before, that as patients age, their metabolism gets worse anyway. Mm-hmm. So some of those, that may be one of the causes for this return of the diabetes.
Mm-hmm. Mm-hmm. I see. Okay.